When I began this journey, I had to go through different steps to prepare myself. And some of it was physical, some of it was mental. After meeting with Dr. Lenz, one of the first things that I set up was my first appointment with Jessica Carter, who was my dietitian. She is amazing. I have learned from her. I have grown from my conversations with her. The first time we talked, we just talked about my life and why I felt like I needed to do this and what kind of things I enjoy doing. And then she said, here's your assignment for this first month. It is to count carbs, not calories, just carbs. Don't make any changes, just count carbs. And I started counting carbs and went, holy crap. So I come from a bread eating family and it's wonderful, and yet it's not. And so I counted carbs and I went to my next meeting with her. My insurance required me to meet with a dietitian once a month for 6 months before the surgery. And the second time I met with her, I was like, oh my God, I no longer eat ice cream that has things mixed in it. I'm not supposed to say Blizzard, am I? Because of how many carbs are in there. And she said, now you have to change one meal. I said, well, oh, I've already done that. I've started eating breakfast. And she's like, good. And so she had a checklist that we went through the 6 months, and I learned about what I could do and what I couldn't do and what was required of me, and how to make some of those changes. And it was so healthy. I really thought at the beginning that having to meet with a dietitian was just a hoop to jump through. And I found that, man, did I learn from her. And since the surgery, I have continued to see her.